everywhere in the country right now. Educators are trying to figure out how to get education going again. It's basically every state and in some instances every school district or even school for themselves. At Michigan State in East Lansing, they're exploring a combination strategy that's going to be new to them and that might be new for anyone else. And it starts with a spit test developed at the university by a neuroscience professor named Jack Lipton, this man. The kit costs around $3 a piece, and as you can see, it's pretty simple. You can do this in the privacy of your own apartment or dorm room. You put your sample in the vial with the little barcode, you seal it in the bag, and voila, your part is over. The lab at Michigan State will take your sample and combine it with others in what is known as pool testing, which maybe you've heard about recently. The idea behind pool testing is that it can help labs do more, way more, with way less. Instead of having each person take their own separate test, you pool the samples from a small number of people, about a dozen, and you run a single test on that pool. If the pool turns up positive, only then do you need each person in the pool to take a test. But if the pool turns up negative, you're done. The single test covered a dozen people. In a place where you expect a lot of negatives, pool testing is remarkably efficient. At Michigan State, they're going to step further than that. Each volunteer who takes a spit test goes into two separate pools of about 10 or so people. So think about it like each person gets to be on two teams. You're a Miami Dolphin and a Seattle Seahawk, or you're a Houston Rocket and a Minnesota Timberwolf. Choose your metaphor. The point is, if two pools come back with positive results, it can only mean one thing. The lab just finds the person who belongs to both pools using a handy grid like this one, and then recommends that that person get a follow-up diagnostic test. It's like playing bingo. B6, bingo. You might have coronavirus. That's what Professor Lipton plans to do with samples from MSU volunteers, testing 2,000 of them every day and referring any apparent positives for an individual diagnostic test. Now, the third and most unusual part of this plan has to do with sewage. Scientists are discovering that they can spot a rise in coronavirus cases early on by testing a community's wastewater. Michigan State professor Joan Rose and her team have been testing the campus wastewater since April. She says they noticed a peak in the virus that lined up with the news about an outbreak at a college hangout, which demonstrated that their sewage diving expeditions worked. I made that up. I don't know if they're actually diving. Now, for the testing this fall, the idea is to sample the wastewater from different places on campus so that they can get hyper-local data. If they can get good enough at sampling and turning around their results in a timely fashion, their work could act as an early alert system for Michigan State, perhaps even at the level of individual buildings. So, you've got the pool testing with the affordable spit kits. You've got expanded diagnostic testing, but literally just for those people who appear to be positive or just plain turn up sick. And then you've got the wastewater testing, which increasingly looks like a functioning means of getting a warning in time to react. If the plan works, it could help the university find and contain outbreaks. If it works, the plan could help Michigan State and its 67,000 students stay on campus and have something like a normal semester. Joining us now is the aforementioned Dr. Jack Lipton, chair and professor of translational neuroscience at Michigan State University. Dr. Lipton, thank you for being with us. We've heard about pool testing. I want you to tell us a little more about it and why it is specifically helpful in this instance. What about Michigan State makes it a perfect candidate for this pooling of spit?
Well, when you think about pooled testing and Michigan State, one of the things that is really important is to understand that the resources that we have as a university are fairly limited, right? We're not a multinational corporation, so funds are limited, resources are limited, and pooling allows us to have more tests being done with the same amount of resources or with less resources. So in this case, if we're dealing with supply chain issues with testing, if we can test 10 people with the reagents that we would need to test one person, then we're saving a lot in terms of supplies. And if we don't have to run 10 tests and we can run one test, we save a lot of time. So if you can save time and you can save supplies, you're going to ultimately conserve. And that's really what our goal is.
And this works. This works because you're not expecting a large proportion of people to have this thing, right? So generally speaking, a bunch of these pools will come out negative.
Right. Pools, if you have about 10 people in a pool and your expectation is maybe seeing 2 or 3 out of 100 people show up as positive, then most of your pools are going to be negative. The more the prevalence increases or the more the rates of infection increase, then you're going to have more and more positive pools. If 1 out of every 10 people are positive, then a pool of 10 most likely is going to have a positive individual in it. So you have to really balance pool size and prevalence together in order to come up with the right balance to save resources and save time.
So this actually could have broader implications. There's a Wall Street Journal op-ed that you wrote about a previous test, not this one that we're talking about, but it was a concept of pooling. And you said across the United States, tens of thousands of similar academic research labs have the expertise and equipment to help the country test for COVID-19. If even 1/10 of these labs join the effort, we could test an additional 500,000 to 1 million samples a day. Your larger point here is that there are ways to get to more people and then figure it out early rather than what we're in right now, where there are some places where people are waiting in excess of 7 days for typical test results. In a concentrated environment like Michigan State, you can see things early and intervene.
Absolutely. And I think it's really important to note when you were talking about the op-ed that we put together, the vast amount of resources and know-how that exist at academic laboratories at universities across the country. One of the things that we proposed was to develop a biomedical National Guard and utilize all of these individual laboratories across the country and have them be organized through the federal government in order to be able to respond to pandemics or other natural disasters with biomedical know-how. And I think that if we could get something like that done, if the next administration is interested in doing something like that, we can be proactive instead of reactive in these kinds of situations.
Wow, that's incredible, because you just answered the question I was going to ask. I was going to say, hey, what can government do to take advantage of these kind of resources? And you just answered that. I just want to say that again, a biomedical National Guard. What a great, simple idea. Resources all over the country, run by different people, but the government of the United States providing the centralization for the data and the distribution.
If you think about all of the laboratories and universities that were shut down as a result of the pandemic, so many people were sitting home. Like I'm sitting home on Zoom all day. If we have the opportunity to come back into the laboratory and help, we can do so much in terms of trying to not only develop new treatments and working on new methods of detection, which is what our laboratory did during April. But we can marshal all of these resources and all of this know-how that exists in order to attack this problem in a concerted and coordinated way.
Dr. Lipton, there's not a lot of great news about coronavirus, but I have to tell you, after this conversation, I'm optimistic that there are people like you around this country who are actually in this moment, while everything looks as grim as it is, finding solutions that are going to help us see the other side of the coronavirus. Dr. Jaap Lipton is the chair and professor of translational neuroscience. I don't even know what that is. We'll talk about that another time at Michigan State University. Thank you for all that you are doing, and good luck to you at Michigan State.